So now we're going to go to the top of the pyramid and talk a little bit about surgery, because in spite of all these new technologies and new office-based treatments, there's still a role for surgical rejuvenation of the face. So the myths of facelift, which are kind of the topic of today, are based on years of seeing patients in the office. And everybody comes in and goes, I want to look like this, but I don't want a facelift. And so then I say, well, why? What is it about a facelift that you don't want? Well, I don't want general anesthesia. Well, we don't do general anesthesia anymore. You can do it with IV sedation. Well, I don't want to look stretched or pulled. Well, that's all technique dependent. You shouldn't look stretched or pulled if you have a good facelift, which is done where we are repositioning tissues, we're tightening them at the deeper levels, and basically just removing the extra skin that's been created. It's not a matter of pulling the skin tight. That's not what a facelift is. All the rejuvenation we do is designed to make you look naturally refreshed and rejuvenated, not different or surgical. So, and the problem with the natural result is that everybody sees people out there that don't look natural. You see people that have obviously had things done that don't look right. The earlobes are pulled down, or there's visible scars on their face, or the ratios of the face aren't right, or there's lines that are pulled in an unnatural direction. And those are the ones you see. You don't recognize that the woman who looks 50 is actually 70 because she's had really nice work done, and you don't know it because she looks natural. So, good work should always be discreet. You shouldn't know that anybody's had anything done. And this is the most common one because people are really afraid of looking different or unnatural or looking like they've had surgery. Downtime, I think people recognize, is much less now, with facial rejuvenation, 1 to 2 weeks typically in terms of getting back to normal activities. So that's less of a concern nowadays.